menopause. Menopause is defined as amenorrhea occurring more than 12 months. Amenorrhea means absence of menstruation. Another bioclinical sign is a decrease in estrogen, which relates to the depletion of follicles in the ovaries. I think it is important to look at the changes of estrogen levels throughout the female life cycle to see how menopause occurs. So here I'm drawing a graph, the estrogen concentration on the y-axis and age on the x-axis. So 10 years, 20, 30, 40, 50, 60 years. During puberty, estrogen concentration increases. This is when adolescents develop secondary sex characteristics. And then during adolescence, they begin having their menstrual cycle. And during the menstrual cycle, the estrogen concentration fluctuates, but it still remains relatively high. Now, during pregnancy, estrogen levels rise. This is in order to prepare the female for parturition and breastfeeding. Then again, there is normal menstrual cycle with estrogen concentrations fluctuating till about 40 years old, when women tend to hit menopause. Now, menopause usually occurs between mid to late 40s and lasts for about 4 years. In early menopause, the estrogen concentration are relatively stable. However, towards the end of menopause, you have a drop of estrogen concentration. So after the 4 years of menopause, you have postmenopause, where estrogen concentrations are very low, and there is no more menstruation, no more menstrual cycle, so-called amenorrhea. And we will have a look at why there is no menstruation in menopause and why there is low estrogens. So we can say that before menopause, when estrogen levels are rising and relatively stable, this is the premenopause stage. So let's have a closer look at the two stages of menopause, the early and late stage of menopause. Now, hopefully this won't sound too confusing, but in early menopause, as I mentioned, there's normal estrogen levels. And because there is normal estrogen levels, there is normal FSH levels, another important hormone that is responsible for actually stimulating estrogen production. However, in late menopause, you have a decrease in estrogen levels. And because you have a decrease in estrogen, you have an increase in FSH. And that is because FSH wants to try to produce or wants to try to stimulate more estrogen production. Unfortunately, estrogen cannot be produced despite the increase in FSH. So I hope that was not too confusing. Let us look at these hormones in a bit more detail and how they are related. So here is the hypothalamus, an important endocrine tissue in the brain. And below is the pituitary gland, another important endocrine tissue made up of the anterior and posterior lobes. During a female's new cycle for menstruation, so just after a woman experiences her period, the hypothalamus produces a hormone called GnRH, which stimulates the anterior pituitary here to produce and release follicle stimulating hormone, or FSH. Now, FSH, follicle stimulating hormone, travels to the ovaries, which are the female gonads, the tissue that makes the female eggs. What follicle stimulating hormone aims to do is to stimulate the maturation of follicles, of primordial follicles in the ovaries here. In the ovaries, you have thousands, heaps of primordial follicles ready to mature. These primordial follicles have follicle stimulating hormone receptors. They have FSH receptors. And so, when FSH is being produced, some of these follicles will mature. And as these follicles mature, they begin producing estrogen. So we can say that FSH's role is for follicle maturation as well as estrogen production indirectly. However, only one follicle will mature faster than the rest. This is because it has the most FSH receptor, or it has a higher affinity for FSH. And it is this follicle that will ovulate and release the egg. When ovulation occurs, when the follicle releases the egg, no more follicles mature, and the follicle that ovulates become the corpus luteum. The corpus luteum is essentially a dead follicle that will degenerate, but also as it degenerates, it will secrete estrogen. Okay, so that was a normal menstrual cycle in that this occurs each month. There's ovulation each month. There's a corpus luteum that degenerates each month. Now, an important concept to understand that relates estrogen to follicle stimulating hormone is that when you have an increase in estrogen, when you have high concentrations of estrogen in the blood, they will inhibit the release of follicle stimulating hormone because you already have high amounts of estrogen. However, if you have low amounts of estrogen, this will actually trigger the release of follicle stimulating hormone because you want more estrogen to be produced. So now let's see how all this relates to menopause. So what happens is when a woman hits menopause, this is where there is an exhaustion of follicles, when the follicles are depleted, when there's little to no follicles left. However, in early menopause, there's still some follicles maturing, and so you do get estrogen, the estrogen concentrations are still there. However, if this happens each month after each month, and there's less and less follicles maturing, you have less and less estrogen being produced. So when you have less and less estrogen being produced, this will actually stimulate the release of more FSH. And because it will stimulate the release of more FSH, this will desensitize the follicle to FSH. And so as a result, because there's so much FSH, it just will not work on the follicle. And so you actually have no ovulation occurring. And so this is where menopause occurs, basically. And when you slowly the follicles just stop maturing and the estrogen concentrations just drops. Okay, so I hope that made sense. So factors that can hasten the onset of menopause include smoking. Smokers undergo menopause 2 years earlier than non-smokers. Let us now look at some symptoms of menopause. So some neurological signs and symptoms include depression, anxiety, memory loss, labile mood, and headaches. Menopause also triggers hot flushes, which is where one experiences a sudden feeling of warmth in the face, neck, and chest area for about 4 minutes. And this can trigger night sweats. Other symptoms include joint pain and weight gain. Urological symptoms include urgency, frequency, dysuria, and incontinence. Vaginal symptoms and signs include dryness, which increases the chance of getting the female of getting urinary tract infections as well as other infections. There's also discomfort, itching, dyspareunia, and vaginal atrophy. So there's no prevention for menopause. It is a normal physiological process that occurs in females. But treatments are available to help with symptoms, and these include hormone therapy, administration of estrogen. You can also administer gabapentin, and as well as moisturizers and topical hormones to treat the vaginal symptoms. So I hope you enjoyed this video on menopause. Thank you for watching.